A very warm welcome to everyone on the call to today's ISNTD Connect session. I'm Marianne Compere. I'm speaking from sunny London, and on behalf of the International Society for Neglected Tropical Diseases, it's really a huge pleasure to welcome you today ahead of World Zoonoses Day, with some birds in the background to illustrate that, and to shine the spotlight today on a still very misunderstood, underreported parasite, Taenia solium, causing Taeniasis, with often quite misunderstood impact on communities. So it's a huge pleasure today to delve a little bit deeper in this complex topic. We have on screen our speakers for today, and I'd like to, I'm sure you will join me to welcome very warmly our speakers. First of all, Nicholas Ngwili, welcome. You're Postdoctoral Fellow at the International Livestock Research Institute, the ILRI. Welcome, Nicholas.
Thank you.
Thank you for being here today. Welcome also to Matt Dixon-Zegeye. Hi, Matt.
Hi.
Matt, you are Senior Research and Innovation Advisor at Unlimit Health, and you're also Research Associate at Imperial College in London. It's a pleasure to have you here with us today. And a very warm welcome as well to Leanne Thomas. Hello, Leanne.
Hi, everyone.
Leanne, you are a lecturer in OneHealth and Food Systems at the University of Edinburgh, and you're also a scientist at the International Livestock Research Institute, ILRI, and I believe you are joining us not from Edinburgh, but from the beautiful Kenya. So welcome. Thank you for being here. We are also waiting for our fourth speaker, Prudence Benamario, Program Manager for Bilharzia and Worm Control at the Uganda Ministry of Health. Hopefully, Prudence will be with us very shortly as we try to finalize some of the connection details. Without any further delay, also a very quick and warm welcome. Lovely to see you, Professor Harmandi. You are tuning in from the Research Center for Hydatid Disease in Iran. If anyone else who's on the call wishes to say hello in the chat, please. It's always a pleasure to know where you're connecting from and who you are, so don't hesitate to say hi to everyone. But without any further delay, I'm going to hand over to our presenters to give us a really good overview of the burden of Taeniasis and really particularly lessons learned from an amazing program through the OneHealth approach in Northern Uganda to really highlight what can be done to control the pork tapeworm and also its impact in affected communities. Thank you so much, presenters, for being with us, and I'll hand over to you for our presentations and to hear all about your work in the SUSTAIN program. Over to you, Nicholas.
Thank you, Mariana. I'll go first. Please confirm you can see my presentation.
Perfect. Thank you.
Yeah, so my name is Nicholas Ngwili. As Mariana mentioned, I'm a postdoctoral fellow at the International Livestock Research Institute, based in the headquarters in Nairobi. I majorly focus on my research is around neglected zoonotic diseases, and we've had a major focus on Taenia solium, which I'm going to give you an overview about it shortly. So I've titled my presentation Collaborating OneHealth Research on Taenia solium in Uganda. So I've organized this presentation in just three parts. One is giving you an introduction to the tapeworm. As Mariana mentioned, it's poorly understood and even amongst professionals. And then I'll mention what we've been doing in Uganda and conclude by just pointing out what all those efforts have led to and where we are. And that's the bit Matt will pick from. So Taenia solium is a zoonotic parasite, as I've mentioned, is one of the most neglected parasites. It's also commonly known as the pork tapeworm. And here, this picture is just showing the life cycle, which has both humans and pigs. And just to make it clear, this parasite causes 3 diseases. 2 of those diseases are in humans and 1 is in pigs. Now, in the next few slides, I'll take you through so that at least you get a better understanding of the parasite. So the first disease in humans is called Taeniasis, or the presence of the adult tapeworms in the small intestines of humans. And humans get infected by consuming poorly cooked pork or raw pork. And as you can see in the life cycle, where you have the picture of human there circled in red, that is the tapeworm, and it's enlarged up there. That is how it looks like. It looks like a tape with many segments from glotids. And when it matures, then humans pass the eggs and pieces of the tapeworm through feces. So, of course, the risk factors for getting this parasite is through, as I mentioned, the consumption of poorly cooked pork. And then the next disease, so once these eggs get into the environment, they contaminate the environment. And if we have pigs which are free roaming or not confined, they can pick those eggs. And then they develop the intermediate stage of the parasite, which is presence of cysts, or this, if you can see the picture below, those kind of nodules, they look like rice grains in a kind of translucent sack of liquid. And that disease is called Post-Doctoral. And it's present in most of the muscles. Like this one is a heart muscle of a pig, and this is a leg muscle from a pig also, with very many cysts. So free roaming pigs becomes the major risk factor here. Then the last disease is actually an accidental infection, which happens when humans ingest the eggs. So remember I said eggs contaminate the environment. Of course, poor hygiene can also expose humans to infection, to ingesting the eggs, or not washing fruits and vegetables. And when humans ingest the eggs and not now the cysts, they develop again the intermediate stage. In short, the parasite takes the human body as that of the pig, and the cysts also can launch in muscles, eyes, but most importantly, they go into the central nervous system and already can cause what we call neurocysticercosis or epilepsy. And actually 30% of cases of epilepsy have been shown to be due to this parasite. It's a parasite which exerts a lot of burden, and for Uganda, it's been estimated to be around 170,000 disability and just life years, which is a huge burden.
Hi, Nicholas. I'm so sorry to interrupt. I believe somehow you've just gone on mute, unless that's just on my side. Oh, you're back.
Oh,
perfect.
That's strange. I didn't click that. Sorry about that.
No.
So I just need
the start from this slide and a tiny bit the end of the other one, but we can start from this slide. Thank you.
Okay. Yeah. All right. This was on human cysticercosis, as I mentioned, neurocysticercosis, and now I wanted to just give a quick overview on how we can control this parasite. And looking at the life cycle, we have different stages or points at which we can interrupt the infection. One, having the adult tapeworm, it can be treated by getting dewormed, either visiting a clinic and getting dewormed. Of course, there are community level interventions like giving praziquantel at mass, so what we call mass drug administration, and that kills the eggs and prevents them from being released to the environment. Of course, use of toilets, making sure that proper sanitation so that eggs do not find their way to the environment, so that is use of toilets. And if the eggs are in the environment, if pigs are confined here, so confinement of pigs, then again, you break the cycle there because they can't pick the eggs and can't develop the intermediate stage. There is also a treatment for the pigs using oxfendazole, which is a dewormer which kills the cyst in the muscles, and that can be used to also treat that. There's a vaccine also for preventing infection with the post-cysticercosis, but of course it is challenges in terms of the logistics in administering it and having to do repeated doses because pigs do not live for that long. Then finally, we also have meat inspection. So if pigs somehow have the infection, they can be inspected and condemned, and therefore they don't find their way into the human value chain. And then overall, at community level, also education on husbandry and sanitation can also control the parasite. So this parasite is endemic across the world in most parts of South America, Sub-Saharan Africa, and Southeast Asia. And it's been, the prevalence has been estimated in different places, mostly for post-cysticercosis, the disease in pigs, because it's easy to study that one. But of course, there are challenges in terms of diagnostics for the parasite due to specificity and sensitivity of the available diagnostics. MCC not widely studied, and that's a huge gap. And of course, Taeniasis has been studied, but not as much as post-cysticercosis. So our focus has been in Uganda, which is potentially endemic. Reason being, we know Uganda in the East African region is the leading producer and consumer of pork, and therefore, the pigs are kept under semi-intensive kind of production system, which makes them predisposed to picking the infections, because there are also instances of poor sanitation. So for Uganda, we took an innovative approach by thinking, if you look at the value chain, the life cycle I've just presented, it's easy. We see the interventions are quite simple things to do, but we know that that has not been working. So our hypothesis was that probably is because we do not understand the context. So starting from when I was doing my PhD, we set out to understand the context, and we described it to be composed of these four factors: socioeconomics, which encompass the knowledge, attitude, and practices in the target communities. We have operational factors, the support from the local stakeholders. We have staff to implement interventions. Governance, the framework, the policy framework and laws governing different interventions, for example, meat inspection, which needs to be enforced by the government. And also, most importantly, is the epidemiology. You need first to understand how spread the disease is to be able to control it. And so we tried, our work in Uganda has been majorly focused on first understanding this context, filling those gaps. So what we did first was to try and understand what has been done in Uganda by doing systematic literature reviews. And the yellow dots show the distribution of the different studies across Uganda. But most important point to note here is most of the studies were focused on post-cysticercosis. So there's still no data on, very little data on neurocysticercosis and also Taeniasis. Then we added another innovative component there by mapping the risk across the country using data we obtained from what we call the Demographic Health Service. They publish data on sanitation, poverty, and then we added another component from the FAO database on the pig population density. And so when we overlay those three risk factors, we could see the change across Uganda in terms of the risk. This is as of 2016, and the dark brown is where the three risk factors exist. But we also know where there is red and also orange, there are two of the risk factors, and chances are the other one still exists, and therefore there is possibility of having high endemicity. But Eastern and some parts of Northern Uganda showed to be high endemic areas. So then, based on some reports we were getting based on another project which was running in Uganda, we started receiving reports that there is a lot of infections in Northern Uganda, and therefore we set out to focus in 4 districts up there, district of Kitgum, Lamo, Agango, and Pader. And the first thing was to understand the value chain. So we did participatory mapping of the value chain, and we found that risk exists across the different nodes in the value chain, right from production, where farmers do not confine pigs and do not have access to inputs, up to the failure of meat inspection, and therefore contaminated pork or infected pork find its way into the consumers. And that work has been published. So the next bit we did is study the epidemiology, and we've already found that across the 4 districts, there's a prevalence of 17.4% based on antigen ELISA. And because we know that technique has issues with sensitivity and specificity, we set out to buy a few of the seropositive pigs and confirmed by dissecting and found that they really have a lot of cysts. Then finally, we did what we call co-creation workshops using system dynamics modeling, where we bring stakeholders together first to see whether they understand the parasite and what they think would be the priority in terms of the control of the parasite. And they put down use of latrines, hand washing, the treatment of humans and confinement of pigs, and meat inspection and so forth as important control option. So this work, what we've been doing, and together with other partners from the UK and the Ministry of Health in Uganda and the universities in Uganda, Ngwili and Makerere, we put together a proposal which has been funded, and we've nicknamed it Sustainable Strategies for Taenia solium Interventions. And really what we want to answer here is whether there is added or whether we'll get better outcomes if we treat humans and at the same time also treat pigs with the dewormers that I mentioned. And this will be the focus of Matt's presentation, and he will give us more details about the new project. So this has been collaborative work right from the work we've been doing with many partners up to where we are now. So that's the end of my presentation. Thank you very much.
Thank you so much, Nicholas, for really bringing us up to speed on this really misunderstood health threat and very underestimated. It's still shocking to hear it's connected to anywhere between 30 and 70% with epilepsy in at-risk communities, and just to start getting an insight into, on a practical level, what can be done between all of these very impressive, fantastic partners on screen. So thank you so much for that. And so it's time to hand over to you, Matt, for our next presentation, which we'll just put up now. And to our audience, any questions that may be springing to mind as our presenters go through their slides, please don't hesitate to put them in the chat. As you're familiar with, we do have time for a discussion towards the end of the webinar, so please do go ahead. Any questions, also sharing any of your work from different regions around the world in this field. So while you think about that, I'll hand over to you, Matt, and thank you for being here too.
Thank you, Marianne. Yeah, so I will present off the back of Nicholas's presentation in more detail on the project to start in Uganda, Sustain Uganda. So this is hot off the press in terms of the project just started on Tuesday, the 1st of July. So it's a 5-year project in total. So hopefully we'll have an opportunity over the next few years to come back and present some of the findings as they emerge from the work. But this presentation essentially sets the scene for the work that will be done. And, you know, it'd be great to have feedback on the proposed work, and hopefully this can form some of the discussion in the next part of the webinar. So initially just setting the context in terms of looking at the Uganda NTD master plan, and within the master plan there's a gap assessment, in particular highlighting a gap around multi-sectoral collaboration, coordination of stakeholders, which is lacking. And this is, of course, critical for zoonotic NTDs in particular, where multiple sectors are involved and would be needed to coordinate and collaborate in terms of implementing any sort of control program. So for Taenia solium, this is an issue, and specifically for Taenia solium in the NTD master plan, there's elements to do with the fact that the disease is obviously zoonotic. So there's leaning on this first point, that there's confusion as to which sector should be responsible for addressing the problem. Should it be the health sector or the agricultural sector? And then in the master plan as it stands at the moment, there's a point about that there's limited information on the distribution, prevalence and incidence of Taenia solium in Uganda. But as Nicholas has presented, some of those gaps, particularly with the second point, are beginning to be completed now in terms of understanding where the risk factors are, the distribution of prevalence and hotspots for potential infection, for potentially targeting control efforts. And also there has been a study on the economic impact in terms of the burden of disease affecting both the human and animal sectors, published in 2022 for Uganda. So there is work now filling in this third point on this slide. With that in mind, now we've got some idea of the actual hotspots and the magnitude of the problem in Uganda. The next steps are really to try and identify sustainable control strategies. In the WHO NTD roadmap for 2021 to 2030, there's a key theme around intensifying cross-cutting approaches. And then if we drill down into T solium specifically, one of the critical actions required to reach the targets by 2030 of intensified control in hyperendemic areas is around effective interventions, particularly evaluating the efficacy of current treatment strategies and knowing what sort of works in particular settings, given the specific context, the epidemiological and socioeconomic context of each setting, and also testing sort of longer term interventions with having sustainability in mind, especially where in certain settings perhaps elimination's not feasible in the short term. So thinking about control over a longer term and what will be required there to make that feasible. So with these two things in mind, essentially we have these challenges that can be addressed, and we'll introduce our vision with this project. So currently there's evidence that human MDA alone will not be sufficient to even control sustainably Taenia solium. So not even thinking about elimination here, just control. With improved outcomes, however, are seen when approaches are combined between sectors, between human and pig direct interventions, especially if we're thinking about control. But evidence is still lacking in terms of the incremental effectiveness of adding, to say a human MDA program, the incremental benefit of adding a pig MDA program, for example, especially around the economic impact, also the local acceptability of doing this, the sustainability and scalability of these interventions. So our vision really is to evaluate two MDA strategies, one targeting humans only and another targeting both humans and pigs. So as I've already touched upon, the idea is to establish the incremental benefit to human health and economic outcomes of integrating a pig-human MDA program. So we have four key research questions that we seek to address in the SUSTAIN program. Essentially, the first one being, what is the incremental benefit of adding porcine treatment with oxfendazole to MDA with praziquantel in humans? Secondly, determining the incremental cost effectiveness of adding porcine treatment. Then we want to consider the social cost benefit ratio of the two interventions. And then finally, what are the opportunities and barriers to sustainability of the intervention package? Really thinking there in terms of potentially national adoption of a control program and then scaling up nationally. So this schematic sort of encapsulates the various elements of the project that will be implemented over the next 5 years. And we have the different colors representing sort of the different areas of work. On the left-hand side that I've highlighted with the red box is one of the core activities, which will be a trial. So I'll focus on this area first and describe this in a bit more detail. So we will have a cluster randomized control trial with eligible clusters being villages within study districts. So I've already touched upon there'll be 2 arms to the trial over a 2-year time period, with the first arm being human MDA with praziquantel delivered every 6 months. The second arm being, again, human MDA with praziquantel every 6 months, but with the addition of treatment of all eligible pigs with oxvendosol every 6 months. So all villagers at the end of the trial will then receive pig treatment and an educational package, which includes animal-inclusive wash, a food safety and a pig husbandry element. So the key data collected during the trial will be at baseline and at end-line porcine cysticercosis and human cysticercosis seroprevalence data in each cluster. There'll be data collection around the cost of the intervention from a programmatic perspective, the local cost of illness and adverse events data, pig production system data, and also data collected through a fidelity assessment. So this will very much form a picture around the feasibility of such an intervention in this setting. And this will take the form of audit reports and data collected through the coverage survey work. So the primary outcome for the trial will be the difference in end-line porcine cysticercosis seroprevalence, with the secondary outcome being the incremental cost effectiveness. So Nicholas already described the situation in Uganda, and he highlighted a risk map there. So we partially used that to sort of guide an area in Northern Uganda, whereby we might want to think about implementing this study. But then Nicholas also highlighted a piece of his work which was focused on a seroprevalence survey in 4 districts in Northern Uganda bordering with South Sudan. So these 4 districts are Lamwo, Pada and Agago. So you see the map on the right-hand side where all the sample villages are, with red data points indicating positive villages there. So these will be villages that will potentially be considered for inclusion, but equally we may be considering other villages for inclusion in the trial going forward. So now we move on to the next component, which will be critical throughout the project, and that's associated with a piece of work on the transmission and health impact modeling to support the various components of the project. So we'll be using a existing Taenia solium transmission model called EpiCyst, which at the moment in its current formulation is a population-based model, and it's deterministic in nature. We've already used this model to help with the grant application itself. So you see these panels in the top of the slide here, which were essentially showing the potential effect sizes associated with the sensitivity analysis being based on the range of efficacy for praziquantel, for example, and also coverage, potential coverage ranges in the human and pig host when implementing the MDAs. So that generated different effect sizes that we could consider, and that was then used to essentially calculate our sample sizes in the grant application. So this model's already been used, but there'll be some critical work in order to reformulate the model in the project, essentially because we'll be modeling villages at the village level, and these are very small population sizes. So we essentially need to develop a stochastic version, a probabilistic version of the EpiCyst model in order to capture stochastic effects that happen in small population sizes. And then with this reformulated version of the model, we'll be seeking to validate the model, which is a gap in the literature in terms of transmission models and having more confidence in them. So we need to validate them with real world data. So we'll be doing that with the trial data that emerges from the study as we go through the years. And then with this model, we'll be able to build out a model extension to it, which will have a morbidity component associated with neurocysticercosis. And this will essentially enable us to project the longer term porcine cysticercosis, human cysticercosis, human taeniasis, prevalence dynamics, and also the morbidity prevalence dynamics. So we can think about dynamics beyond the end of the 2-year trial period. For example, if we want to look at scenarios where MDA rounds could continue, if we want to see what prevalence looks like after continuing MDA for another 2 or 3 or 5 years, for example, or if MDA stops, what will the rebound dynamics look like? So this will be an important component. But essentially, it will allow us in the longer term to look at the morbidity and from that DALI estimation for the burden of disease work. So the final component, but very importantly, and something that will be conducted from the outset of the project, is the policy engagement work and also the feasibility assessment work. So this is really critical in terms of formulating recommendations and considering the outcomes at the end of the project in terms of whether they could be nationally adopted for a control program. So firstly, the economic evaluation. There'll be programmatic derived costs of the intervention collected for each intervention round, both in the pig and human side of the MDA work. We'll also be collecting cost of illness and the costs associated with porcine cysticercosis in order to look at the cost of averting illness and porcine cysticercosis cases. Now, these two elements will feed into various aspects of the economic analyses. So firstly, we will be looking at a societal burden of disease averted analysis, and this will essentially be working with frameworks that already exist, calculating the burden of disease, such as the work that was published in 2022, looking at the economic impact of solium in Uganda, but leveraging the transmission model so that we can essentially have a dynamic version of this burden disease piece of work, but also with the trial data to understand how cases are essentially and the burden disease is averted between a counterfactual example, for example, a counterfactual situation and a situation where we have control through the program that will be implemented over the next 5 years. So then we'll be able to use the programmatic data and the cost of illness data to look at a cost effectiveness analysis. So this will be very much from a government perspective, which will be important for the policy work over a 10-year time horizon. So we'll be looking at the program cost of intervention compared to the cost of illness averted from a healthcare perspective to feed into the cost effectiveness analysis. But the piece that's missing here is the economic impact on the animal health sector. So this is why the final piece is important, which will be the social cost benefit analysis. So here, this enables us to incorporate costs and benefits across multiple societal sectors. So this is where we really bring in the work associated with the cost of porcine cysticercosis averted. And it enables us to calculate a cost benefit ratio or a net benefit measure from a societal perspective. So across multiple sectors, and that will be really critical to understanding the true economic assessment here. And then we have the process evaluation and policy engagement. So we're really, with this project, trying to take a systems-based OneHealth approach as much as possible, for all the reasons outlined, particularly with the gap analysis, for example, in the NTD master plan in Uganda. So the Ministry of Health and the Ministry of Agriculture, Animal Industry and Fisheries will be critical to the co-development of the randomized control trial, the modelling and economic evaluation activities from the outset. So now, as the project starts, that engagement is absolutely critical. The integration of the two ministries in sensitization and implementation activities will be central to this work. For example, the Ministry of Health will be leading the human MDA delivery component, and the process evaluation will be critical to the policy engagement work, as I've already mentioned. So this will really center around, again, the co-development of a feasibility framework to determine whether the interventions are adopted and ultimately nationally scaled up by the end of the trial and beyond. So with that, I would like to thank all the project partners. You can see here the funders, the Medical Research Council and the Foreign and Commonwealth Office, and also the ISN.
Thank you so much, Matt. Wow, we're so impressed. We can't wait to hear how and what the project will look like in a few years from now. It's been a really fascinating insight into how you've built it. Really important, as you were highlighting, for this crucial pillar in the NTD roadmap of integration, but also working with so many unknowns, including the economic impact. So it will be interesting in its own right, but also with so many lessons just for the shape and the how the NTD roadmap looking into the future, potentially beyond 2030, will look like as well. So thank you so much for your time today. It's been absolutely fascinating. And we've had a few questions come up in the audience while you were both presenting. Welcome, Leanne, to join us to tackle a few of those and some of the discussions we might have over the next few minutes around this. Just to reassure our audience, we are still working tirelessly behind the scene to ensure Prudence does join us at some point. But I guess while we wait for Prudence, one of the first things we could potentially discuss, and I found that really interesting how you're bringing in the MDA for pigs, and there's been a lot of noise and celebration in the NTD community around the private sector pharma partners that have been engaged and supported human MDA for well over a decade and decades for some of them. And I was curious to ask, how are you finding the support or the effort from the veterinarian side? Are we seeing something similar, or how will that look like?
Well, maybe I'll step in, and I'm a vet clinical vet by training, not a medical doctor. So I think one of the sort of interesting things for the neglected zoonotic diseases as a subset of the NTDs is that a lot of the work on these diseases has actually been driven by the veterinary community, and so a lot of the colleagues that we have that work within this space often come in from a sort of veterinary public health perspective, predominantly moving more into the sort of OneHealth space, and now reaching out and making these collaborations with our colleagues within the medical sphere and the environmental sphere. So this project, the zoonoses within the NTDs are often what we say is the most neglected of the neglected, because there is so much more complexity, and it does require this this level of collaboration and integration that maybe isn't necessarily as strong when you first of all look into a non-zoonotic disease. Though I think it's very clear from things like the sort of OneHealth guide, companion guide to the NTD roadmap, that actually throughout the NTD space, we need to be collaborating and looking at cross-sectoral work. So I think, zoonoses are a great entry point to get both sides on board and really sort of build that collaboration that then will help across the NTD space.
Fantastic. So that's really putting OneHealth into action. Matt or Nicholas, did you want to add to Liam's comments?
Yeah, so I think, I mean, from my perspective, what I've seen with the OneHealth area is quite a lot of it has been led by the veterinary health sector in particular, and to some degree bringing in the human health sectors, is something that's very much needed, but there needs to be that sort of motivation and momentum in order to do that. So I think, particularly what we're trying to do with this study is really put the economic piece at the center of things, to really show, where the benefits are across sectors, in order to identify things like potentially cost sharing mechanisms between sectors in order to alleviate a burden that obviously affects, not just human health. And as Liam was mentioning, something like Taenia solium, it's really the neglected of the neglected in terms of human health diseases. So, there needs to be this body of evidence in order to bring all partners to the table.
Thank you.
And if I may add also, just supporting what Matt said, it's also that kind of evidence is what will also help, push and galvanize the support from government, especially to license some of these medicines like the dewormers in pigs. In most of the countries, they are not licensed yet. So if we have this evidence of how it helps, in terms of better outcomes of controlling these zoonotic parasites, then we can get that final push. Over.
That's a really interesting point. Good to know. And so while we're on this topic of the spectrum of organizations around this OneHealth effort, is there anyone you feel that's missing to this ideal OneHealth task force in Uganda?
Well, this is something that comes up a lot in sort of OneHealth in general, in that we often complain that the environmental sort of component is being left behind. And at the moment, our collaboration doesn't involve the environmental agency and doesn't have a specific work package thinking about environmental contamination. We do have a sort of OneHealth WASH component, which will be integrated at the end of our MDA program to try and address the environmental aspect, but only as it regards the sort of the conduit for transmission. So this often happens within sort of, in infectious disease research. We see the environment as a place through which a parasite or another pathogen is going to pass, and so we think about, well, we're going to look at sort of cleaning up that environment. But there is also an environmental component within what we do. So we know that we're going to be using mass drug administration with praziquantel in humans, with oxybenzole in pigs. The fact that those residues of anthemetics are going to enter the environment could in fact have an ecotoxic impact. What would be really ideal is if we could actually build up a better picture of how that might be impacting the environment itself. So monitoring any ecotoxicity in the environment, monitoring residues, being able to sort of see the environment not just as a conduit of disease transmission, but actually as something that is impacted by disease. So if we zoom right back, sorry, I'm going on a little bit, but if we zoom right back out and think, well, how does disease, before we even get to treating disease, but how does disease impact the environment?
Yep.
Every time you have a pig that's infected with porcine cysticercosis, and that doesn't create a nutritious, healthy meal for somebody, there is wasted resource going into that pig. Wasted greenhouse gas emissions, wasted feed resources. Those are environmental impacts of raising a pig that is infected with porcine cysticercosis. So the more we can do to reduce disease in these pigs and create nutritious, healthy, safe pork for people, we're reducing the environmental footprint for every kilo of safe pork people eat. So we have to think about trying to, what would be ideal, and if we had a bigger project, and if anyone out there is really excited about the environmental component and wants to come and join us, I would love to see more being done to really encapsulate what are the burdens on the environment having this disease circulating, and what are the impacts on the environment of the control strategies that we take. And those could then be brought into that societal cost-benefit analysis that Matt is talking about, so we can really zoom out and actually get a much better idea of what the net benefit of this work is. So yeah, it's unfortunate that at the moment we're still a little bit siloed in our sort of veterinary and medical departments, but there's a lot of scope for really looking holistically at this parasite and its impact.
Well, you can't do everything at once, and it's amazing to hear this real advocacy to bring in the environmental angle, and particularly adding to that more detail to that cost-benefit analysis that Matt was describing. And so I do totally join Emmanuel Mrimi, who says excellent insight regarding environmental impact. We heard that call for partnership loud and clear, so I do hope you will have lots of people joining. Just before we move on to a different topic, an interesting addition by Ulrich Madeja. How about also vaccinating the pigs? Is that something you might think about in future to add to the project?
Yeah, thanks for that that question. So there is an incredibly effective vaccine available for pigs at the moment. Right now, we're not incorporating that into the trial, only because some previous work that was conducted through GalvMed and with ILRI indicated that at present there was little willingness to pay from the farmer's perspective for the vaccine. And so we're looking at oxbendazole with the idea that there's some potential co-benefits in terms of gastrointestinal parasite control, which may impact farmers' willingness to pay for the product in the long run. So at the moment, we're sort of starting with just the oxbendazole, but there's always opportunities if we can demonstrate empirically that we are actually having an incremental benefit from incorporating the porcine treatment into a mass drug administration program in humans. That could be a potential sort of springboard for looking at other pig-based interventions. There has been a large trial of the vaccine with oxbendazole in Madagascar, and I believe they're looking at publishing their results soon. So it'll be interesting to see what's been going on there. And I think having different trial strategies set up to test which one would be most effective in the field is quite complementary. So yeah, it'd be nice to see how we do against the other alternatives.
And lots of lessons learned about farmer incentives, precisely from the University of Edinburgh's Stamp Out Sleeping Sickness project that also ran in Uganda around treating the cattle, and how do you motivate farmers to engage with that? So.
Yeah, absolutely, and thanks for reminding us about that. That was a really interesting trial with the restricted applications of insecticides, and yeah, it's really important to get our farmers on board. I think particularly because we don't necessarily know. One of the issues on OneHealth is that sort of cost sharing. How do we manage the cost sharing approach? And we have a really strong policy engagement aspect with this project. But we can't start with the assumption that it's always going to be publicly funded on both sides of the equation. So looking at what opportunities there may be for private sector investment from farmers is really important to us. So yeah, thanks.
Fantastic. Nicholas, Matt, would you like to add anything?
Yeah, I just wanted to mention also the aspect, supporting what Leanne is saying, but also the aspect of sustainability. These interventions, they have to be owned by the farmers, and of course these farmers need support environment from the government, licensed vaccine readily available, delivery channels and all that, and therefore that also adds a bit of complications into the equation in terms of like use of the vaccine vis-a-vis the dewormer, which farmers, if it's licensed in country, farmers can access and administer themselves, unlike the vaccine. So there are many aspects there which needs to be considered. Over.
Thank you. Matt, would you like to add anything?
I think, most of the points that have been raised are excellent in terms of the sustainability and finding incentives, etc., from potentially different sectors in terms of financing this, because we know there's competing agendas on the NTD in the NTD space in terms of resource prioritization. So, getting the best available evidence, and in this case, looking at a sustainable strategy that might be, you might need to run this over a longer time horizon will be really critical for that particular piece. There's been plenty of work looking at, with the vaccine, for example, in a combined intervention package, looking at sort of elimination over a short time horizon. But they're very resource intensive activities that might be quite hard to implement in certain settings, although in some settings that might be desirable to use a sort of very short, sharp, very resource intensive effort over a year or two, and hopefully you can eliminate potentially T-solium in that time frame according to some of the evidence out there. But for some countries and some particular programs, that level of resource just might not be available over that time period. So then what does a longer term control strategy look like? How can we make this sustainable? How can we look at co-funding, financing? So I think this is what the sort of things we're looking at in this project, and how it separates a bit from the stuff that's already been done in the field. Fabulous,
thank you. Just turning for a few moments to the MDA part of the project. So you've mentioned combining this with praziquantel in MDAs in humans, and we have a great question here from Lydia Tripler. Is MDA with praziquantel already part of the control program for Taeniasis, or is it in place because of schistosomiasis? And also, if there would no longer be any schisto, would there still be MDA for Taeniasis?
Yeah.
I can start. From OneHealth perspective,
So currently in Uganda, there, particularly in this part of Uganda, there isn't any one the last year or two, and considering going forward, there hasn't been treatment for schisto in those areas, although there has been a long history of schisto control starting from around 2002. Of course, with the schisto control program, it also uses praziquantel, the same drug that's used, one of the Taenia drugs that's used to control solium infection. But it's used at a slightly higher dosage, so 40 milligrams per kg in the schisto MDA programs. And essentially what we're looking at in this trial is the lower dose, 10 milligrams per kg, to sort of alleviate some of those potential. There's safety concerns around using that higher dosage in co-endemic areas, given the risk to those who have neurocysticercosis in terms of rupturing cysts in the brain and causing sort of the onset of epilepsy, etc. So that's been a risk to some of the schisto control programs, for example. And that also calls into question the need for sort of co-endemic mapping and really focusing on that going forward to understand these high-risk areas. But anyway, in our trial, this is why we're looking at a lower dosage. And this, if we do consider a lower dosage going forward, this might need to be separate from a schisto program, but equally, there is an opportunity for integration, and this is leaning back into that theme in the WHO NTD roadmap, which is that intensifying cross-cutting platforms, for example, which in this case would be integrating potentially a T-solium and a schisto program going forward, where there's co-endemicity still existing.
Fantastic, thank you. Emmanuel Mrini builds on that question, unless, sorry, if Nicholas, Leanne, if you wanted to add to that. So Emmanuel was asking, building on Lydia's question, how do you envision the coordination of pig MDA? It's would that be via the Ministry of Health or the Ministry of Livestock? And that's really asking from the viewpoint that existing NTD programs in terms of coordination and what it looks like in the field are already quite complex operations. So how do you see this falling into place?
So from the perspective of the trial itself, Makerere University are going to be conducting the porcine MDA because they're also going to be in the field sampling pigs for blood sampling for our diagnostic work. So at the moment, this is purely due to logistical challenges, trying to make sure that we don't have too many teams out there and that everything can be done at once. But we have MAIF as a partner, so that everything can be discussed with the Ministry of Livestock. If we were to go forward and see this scaled up, it's an interesting question, and I think the nearest that we have to look at is rabies control, of course. Now, in many localities, rabies, the actual vaccination is often carried out by an NGO partner or other implementer with the support and coordination of the veterinary department, which would be very similar to our current plan. Often this is the only way to do it because we know that the veterinary departments are incredibly stretched with staff. And so taking large numbers of ministry staff out to conduct vaccination programs is often not feasible. So you're often bringing in multiple private or NGO partners to support that. But as long as there's a coordinating body which would be envisaged to sort of pass over into the ministries, then that's the important aspect. So here within the policy and engagement work package that Matt presented, with one really key thing is this feasibility and acceptability framework, where we need to sort of see this is where the chance for the ministries to tell us how this should work in future, so that we can collect the right data for them to be able to integrate it into wider programming. Matt or Nicholas, would you like to add to that?
No, I think you've captured it well, but also the working with MAIF for this one, because it'll be kind of a first one, also the pig MDA and the human MDA. There are also lessons to learn there in terms of feeding into to the engagement plan, how going forward this can work. So I think we'll be also keen to collect more data, pick lessons from how logistically it works. The bit you raised earlier in terms of sharing resources. So who do you need two teams going to the field for Ministry of Health, Ministry of Livestock, and all of those aspects.
Yeah. And also on the data collection side, in terms of, well, particularly monitoring the outcome of the interventions, in terms of, at the moment, this will be largely done by Ngwili and Makerere universities, but this is again an opportunity for the the two ministries to contribute around how those activities could be sustainably adopted and going forward by the control programs themselves, rather than or in partnership with the universities. So I think that's an entry point, hopefully, to discuss that side of things.
And so just building on that, were there other potential past challenges with MDA implementation in Uganda that are on your radar in terms of moving forward with these?
It's probably something I touched on when I discussed the praziquantel dosages, but just potentially the issues around the higher dosage for praziquantel at 40 milligrams per kg for the schisto programs, and whether going forward in if programs are integrated between T-solium and schisto, if that dosage is used or something slightly different is constructed in terms of delivering a program. I think that's a real challenge for these particular two diseases in terms of understanding how those two programs can work together going forward. There isn't a national T-solium program anywhere, so that in itself is a novel thing. So if that's actually adopted by the end of the project, or something that's under serious consideration because of the outcomes of the project itself, then that's something really important. But then trying to figure out how we can leverage existing resources will be really important. So I think that will help the sustainability of potentially two different NTDs. So yeah.
Fantastic. And any other recommendations or things to look out for, Leanne, Nicholas?
No, I think Matt's captured our key considerations at the moment. Yeah. So, it will be, I think one of the key things for us is that we have this vast knowledge of NDA programs with praziquantel for schisto that we can draw upon. And so, we feel quite confident that with Unlimit Health and the Ministry of Health as the sort of implementers for that, we've got best practice going on in the field, and it's going to be really sort of interesting about how then we sort of add the veterinary component onto this, and those coordination, sort of cross-sectoral coordination, cross-sectoral benefits that may accrue. That's going to be sort of where a lot of our focus is on at the moment.
Yeah. And just if I might add, the other aspects also will be, the issues of coverage, and the bit on sensitization there. With the current era of so much information, disinformation, misinformation, so that's one aspect of careful consideration, so that people understand why we are doing this, and kind of accept and managing the information around that. So we'll have a strong component on the sensitization, so that we get support from the local stakeholders.
Fantastic, thank you. Before we kind of round off our discussions for today, there's one thing we haven't spoken about yet, which is the communities, and at community level, whether that be the families and the people at risk of infection, also the healthcare workers, and I suppose building on something that Shalidra Ranasinghe mentioned in the chat, which was some difficulties with responding to and treating suspected neurocysticercosis. And so I was wondering, from what you've seen, whether you could tell us a little bit more about, first of all, how well do frontline workers distinguish between Taeniasis, cysticercosis, maybe other similar presentations. It's quite complex once you start to talk about epilepsy and neurology. So what does it look like in the field?
Well, with neurocysticercosis, one of the main presenting sequelae is epilepsy and seizures. But actually that area in Northern Uganda, it's also co-endemic, although the prevalence is greatly reduced for onchocerciasis, which there's a recognition now that that's also contributing to the epilepsy burden, although there are very specific sequelae that present for onchocerciasis, such as nodding syndrome and others. So it can be differentiated from more generalized seizure and epilepsy, but this is where the diagnostics come into play. And of course, in these kind of more resource limited settings, conducting widespread neuroimaging is not particularly possible. So really relying on the serology will be important, but also realizing that there are other potential infections out there that may contribute to the burden. So differentiating them will be quite critical.
Yeah. And I just want to add that work that Nicholas has done sort of really on the knowledge and of healthcare workers and vets and other stakeholders, which he did as part of his PhD, really sort of highlighted that people, even working in healthcare settings, have a poor recognition of the life cycle of the pork tapeworm, and so sometimes it can be quite hard for them to explain, the different symptoms and how they've arisen and the different transmission routes. I don't know if you want to expand on that a little bit, Nicholas.
Yeah, and just to add actually to what Mariana was asking about also the front line and how we manage that. We'll have a strong arm or effort on monitoring of advanced events, because that will be critical when we administer praziquantel, especially for people with already existing epilepsy kind of condition, and so we are basing this on WHO guidelines, and so much of it will be sensitization on how to and follow up, and also the sensitization of the local level 2 and 3 health facilities in Uganda, in those regions, just to be able to take care of these cases if they arise. And yes, what Leon says, knowledge is really poor. There's always confusion what comes after what, like taeniasis, post-cysticercosis and neurocysticercosis. And what we realize in Northern Uganda is they know the parasite is there, they've actually seen it, only that they have no idea it's harmful or something which can cause harm. But over time, this is changing because of the continuous work we keep doing there, the sensitization. So hopefully there will be other kind of unmeasured impacts of the project in terms of raising awareness for these parasites.
Yeah. And just building on Nicholas's point around sensitization, which will be absolutely critical, and obviously there has been work conducted in that area in terms of already sensitizing communities, but we know epilepsy is very stigmatizing, so ensuring that cases aren't they don't sort of disappear into the community and people don't come forward, that will be really critical to ensure that there's presentation there, and especially the cost of illness, data collection work, trying to identify those individuals will be really important.
That's really interesting. You mentioned stigma, and just also thinking about schistosomiasis that we talked about earlier in the session. Are there any sort of persistent myths about Taenia solium in endemic Ugandan communities? Does that affect disease control? Anything we should be aware of?
Yeah, just actually what just Matt mentioned, the stigma around that, especially epilepsy, which could be due to neurocysticercosis, is really high. People thinking it's witchcraft, or you've been bewitched, and kids being locked away or kept hidden. So there are all those issues, and there isn't really a very straightforward way of saying this is how you will address this. It's just the concerted efforts, especially on sensitizing and also identifying maybe households with these cases, and maybe providing more information on this. But yes, it's really a disease which is poorly understood, and with a lot of superstitions. And also people will hear there is maybe provision of medication somewhere, but then they'll believe in their traditional way of treating, which further complicates the situation.
Mm.
There have also been, not specifically a belief about the parasite itself, but there's also really sort of interesting, and this is why so much of the work over the last few years has been around understanding the context. So we know from sort of knowledge, attitudes, practices, studies, and other sort of times where we've spent sort of got rich qualitative data from the community, that how they perceive free roaming pigs as sanitation policemen. So we know that the combination of free-roaming pigs and open defecation is incredibly dangerous in terms of propagating the life cycle of Taenia solium, but there's a specific role that those pigs are playing in that community, acknowledged role of this sanitation policeman. So that, you know, that's something that, of course, needs to be addressed over time, but the constraint of bringing pigs in and confining them, you need to understand that then who's looking after those pigs? Well, we know it's often the women in the household. They've also got a lot of other work going on. So do you want to add a huge extra burden on them to go out and find food for those pigs, which are now being kept in a pen, and make sure that the environment is clean for their children to play in? There's also, you know, beliefs and stigmas and social norms around who can use latrines, you know, whether they can be, you know, latrines can be shared between certain family members, and this sort of provision, who's looking after them, who's managing the upkeep, and all of those sort of things which aren't sort of specifically cultural beliefs, but are part of the way that this community is structured and working, sort of need to be considered. And obviously we've got very much a sort of biomedical intervention that we're trialing, but we're very cognizant of these additional sort of factors that are going on and driving the parasite transmission.
Yeah, and just to add also, you know, the norms, customs around that, particularly for Northern Uganda, where we kind of got this information that also they don't throw away meat. Like throwing away meat is throwing away wealth. So whether it's condemned, they want to find a way of eating that meat. So that makes it even more complicated to control. And so another call is, you know, for potential collaboration with people who are interested in doing, you know, those grounded kind of social community norms study, which can really bring out some of these aspects. It would be nice to collaborate.
Exactly, yeah. And from a food safety perspective as well, in terms of, you know, how infected meat, what happens to infected meat in terms of, you know, where does it go, and is there meat inspection practices in place? So I think all of this will feature in understanding, you know, the wider context, and that brings into play this whole One Health perspective in terms of understanding sort of holistic viewpoint there.
Well, I think you answered my last question already. It's been a really fascinating session. Unlike other NTDs, it sometimes feels that there's a greater knowledge about tapeworm. I think just anecdotally, people do, first of all, they can pronounce the name and they sort of understand what it is, but it's been incredible to unpack actually how many gaps are still remaining in terms of advocacy, implementation, just the whole package. We also hear a lot about integration within NTDs and bringing in a One Health lens and a One Health approach. And it's such an honor to see it unroll right here in front of our eyes. As you said, Matt, hot off the press, less than 48 hours since the project itself was launched. So it's been an amazing session. I've learned so much, and I really join Frank Kapungu, who says interesting One Health intervention through MDA. Looking forward to the results of the impact assessment later on. Absolutely. And so before we kind of bring all this to a close for now, because we certainly want to already book you in for the next ISNTD Connect in a few months or a couple of years. Any final words? We heard a very clear call to boost the presence of the environmental sector in your project, but is there anything that you would like to say as final words, whether about Taeniasis, about your own project, about community health in Uganda, that our audience can go out into the world and echo and share?
Okay, everyone's being too polite to jump in first, so I'll go first. So, I mean, really we started off a little bit saying that this is one of the neglected of the neglected. So it really is. Maybe people can say tapeworm and they understand generally what it is, but Taenia solium is incredibly neglected. It's really great if people are interested in this parasite and want to think about how they might be able to consider integrating work around Taenia in their other NTD work. We'd love to keep talking to people and learn from your experiences, and we'll certainly keep sharing. So Matt, would you like to go next?
Yeah, I think just the message around, firstly, sustainability. This is what the program is focused on, particularly programs that, you know, as I mentioned, may not have the resource to, you know, aim for a sort of very intensive program to eliminate Taenia solium in a short period of time, but also really the integration piece and calling on anyone who works in the other NTDs that we mentioned around cysticercosis and onchocercosis. And there's so much work there to be done around understanding the co-distribution of the diseases and then how we can target and build integration programs effectively. So I think there's an opportunity as we progress this particular project to look into those aspects.
Yeah, and for me, it's really on that aspect, on the social work. You know, these kind of studies where people can spend time with communities, understand them better, and know really how we can change some of these norms. That would be an important component. But then finally, you know, sometimes when you talk about Taenia solium, it's neglected, and we say it is in communities with poor sanitation and all that. Actually, there is also risk to even people who do not consume pork, and even now we've seen cases in the West because of imported cases. If somebody is a Taeniasis carrier, is handling food, and they don't observe hygiene, that presents risk to everyone, even in places where pork is not normally consumed. So and people, you know, fear when they hear about the disease and think, if I don't eat pork, then I'm safe. But actually, it's not really true, because you eat pork, you get Taeniasis. Of course, it perpetuates the life cycle, and it can be easily treated. But then the other nasty disease comes by when you don't see, like contaminated hands, poor personal hygiene, and all that. So it's really a collective kind of action for everyone. Over.
Brilliant. Thank you so very much. We really look forward to keeping in touch. I join Sala Viruse Ahimbisibwe saying good presentation, sustained team. Thank you. Professor Majid Harandi enjoyed the webinar very much. Thank you all. Damiano Locono, thanks. Paula Plaza, thank you. It was fascinating. It really was. I don't always say this. It was absolutely fascinating to hear a bit more about this highly neglected NTD. And we thank you so much for your time. Thank you to the audience as well for being with us this morning, bright and early, at least here in the UK. And all that's left for me to do is to really reiterate that you're a group of extremely collaborative institutions and very much open to partnering. So I hope this is only the beginning of a really interesting conversation and partnership. So on that note, thank you so much to everyone who's been here today. And to our speakers, please definitely keep in touch, and we would love to hear about where the Sustain project is going to go. And thank you as well to Paula Plaza from Unlimit Health, who really did everything to bring this webinar together. So shout out to you, Paula. And until next time, well, all the best to everyone, and have a wonderful rest of your day. Thank you so much.
Thank you.
And thank you so much to you. Bye. Thanks everyone.
See you next time.